I am Christy. I'm a neurocertified nurse and have been working with stroke patients for about 10 years. About 2 years ago, the facility that I work in became a certified stroke center and we were introduced to the NIH Stroke Scale. The NIH Stroke Scale is an excellent tool for the healthcare worker that works on a stroke unit or in the emergency department. It is a standardized neurological assessment tool that can be used to determine the severity of a stroke. I would like to take this opportunity to show you the app by StatCoder, the NIH Stroke Scale. This app is a free app and is available only on the iPhone. This app will walk you through the process of assessing the 11 different elements of the NIH Stroke Scale, including level of consciousness, vision, motor skills, sensation, and language. Let's get started. The first thing a person new to performing an NIH Stroke Scale should do is open the instructions portion of this app. It reminds the examiner that the assessment should be done and scored in the order listed. The examiner should not go back and change any scores, and scores should only reflect what the patient actually does, not what you think the patient can do. Coaching should be limited to only what the exam encourages. Next, the person performing the exam will select to begin assessment. You will notice at the top of each page is a scale score. Scales will range from 0 to the highest number. A 0 is considered normal, and the highest level will be the most deficit. You can see the instructions for the page by scrolling down to the bottom. Each page has a set of instructions, and to move to the next page, simply swipe. The first thing you will assess is level of consciousness. This is easily assessed upon entering the room. Is your patient alert? If yes, then the patient will score a 0. A score of 1 will be given if you wake your patient, but it only takes minimal stimuli to get the patient to participate. A 2 will be given if the patient is obtunded or requires repeated stimulation. A 3 is only given to a patient that gives no response at all, is flaccid, or only responds with reflexive posturing. You will then ask the patient what month it is and how old they are. A score is given for the number of questions answered correctly. Note that if the patient is unable to speak due to an ET tube or any cause other than aphasia, they will be given a 1. Aphasic patients and patients unable to comprehend the question will score a 2. Next, ask the patient to open his eyes and then close them, and then make a fist and open it with the unaffected arm. If the patient does not perform the task to verbal command, these tasks can be demonstrated for the patient. If the hands cannot be used for any given reason, then use another one-step command. A score is given for the number of tasks completed correctly. Next, we will look at patient's gaze. This can be performed by having the patient follow a pen light or establishing eye contact with the patient and moving from one side to the other. A gaze palsy is present if the patient is unable to follow the examiner or pen to one side. This will score a 1. If the patient's gaze is fixed to one side and cannot return to the midline, a score of 2 will be given. To test visual fields, have the patient look directly at your nose and tell you how many fingers you are holding up. This should be done in each of the 4 quadrants. If the patient is unable to tell you numbers or is difficult to awake, you can use visual threat. With unilateral blindness, the visual fields for the remaining eye are scored. A 1 is only given if there is a clear-cut asymmetry. A 3 is given if the patient is blind for any reason. You will also test double stimulations and note if the patient has any neglect. This will be scored in number 11. Now we will look at facial palsy. For testing a facial palsy, you can use verbal commands to show the patient how to perform the tasks. Have the patient smile, showing their teeth, raise eyebrows, and close their eyes tightly. Note any asymmetry. A 1 is given for mild asymmetry, or on smiling or a flattened nasolabial fold. If the patient has total or near total paralysis of the lower face, this will score a 2. If there is no movement in the upper or lower portion of the face, a score of 3 will be given. On the next couple screens, we will look at motor strength. Testing the motor strength will be done one limb at a time, starting with the non-affected side. You will notice at the top of the screen there are two different scales, one for the left arm and one for the right. To test arm strength in a seated position, place the patient's arm at a 90-degree angle and ask them to hold it for 10 seconds. If the patient is laying in bed, lift the arm to 45-degree angle and ask the patient to hold it. A small bounce of the arm and then a return to the starting point is normal and does not result in an increased score. If the arm, however, continues to drift but does not touch the bed, a patient's lap, this will score a 1. The limb falling to the bed within 10 seconds but does resist gravity will score a 2. If the limb falls directly to the bed and there's no effort against gravity, a score of 3 will be given. If there's no movement, the examiner will score a 4. On this test, you are able to put a UN, which means you're unable to test if there's an amputation or a joint fusion. The process will be repeated for both arms, and then you will move on to the legs. The legs can only be tested while the patient is laying down. The procedure is the same, except the examiner will place the leg at a 30-degree angle and ask the patient to hold it for 5 seconds. No drift will score a 0. If the leg drifts but does not hit the bed, a 1. If it does hit the bed, a 2. If there's no effort against gravity, a 3. If there's no movement at all, a 4. Again, you can score with the UN for untestable if the patient has an amputation or a fusion. For number 7, we will look at ataxia. This is one of the portions of the test that I see the most inconsistency in scoring. Ataxia can only be scored if it is seen. So if the patient is unable to participate due to weakness or comprehension, the patient will score a 0. If the patient has a visual deficit, ensure that you are performing the task only in the intact visual field. Have the patient touch their nose and then your finger back to their nose and so on. Move your finger but stay within the intact visual field. If the patient has difficulty with the task and misses the finger or nose repeatedly, note that if there is weakness in this arm. Ataxia is only present if it is out of proportion to the weakness. To test ataxia in the legs, have the patient place their heel on top of their shin and slide it up and down from ankle to knee. This can be very difficult for the elderly patient who has hip pain and knee pain, so take that into consideration when you're doing your exam. If the patient is able to keep the heel reasonably on top of the shin with movement, ataxia is absent. On this exam, a point for each limb will be given. If it's present in the upper limb or the lower, if it's in one limb, then a score of 1. If it's in both, score of 2 will be given. Again, you can use the score of UN if you are unable to test it due to amputation or fusion. A patient may keep his eyes open for this portion of the exam. You will perform this portion of the exam using a safety pin. Avoid hands and feet when testing sensation, as they may have decreased sensation at baseline. Test the arms, legs, and face. Ask the patient if they can feel the touch and if there is any difference between the two sides. If the patient indicates a difference between the two sides, but can still feel that he is being touched, the score will be a 1. If the patient is not aware of being touched, a score of 2 will be given. If the patient makes no response, then a score of 2 will be given. Patients in a coma are automatically given a score of 2 on this item. For the next 2 sections, we will look at the patient's language skills. Language is tested by having the patient look at the pictures and then describe what is going on, identifying a series of objects, and reading 5 sentences. To get this far in the exam, you probably already have a decent idea of your patient's comprehension and may have an idea of their verbal skills. Within the application, you are able to enlarge the pictures for each portion of this exam, but I still find them very small and usually will use the papers provided by the facility. If speech is normal, the patient will score a 0. If you know that the patient has some aphasia, you can see there's obviously a loss of fluency or ability to comprehend, but you can still identify the picture or content from the patient's response. A score of 1 will be given. With severe aphasia, the speech will be fragmented, and it may take a lot of questioning and gestures to understand the patient. The examiner will not be able to identify the materials from the patient's response. For severe aphasia, the patient will score a 2. A 3 is only given to patients who are mute and do not follow commands. A patient in a coma will score a 3. A patient who is intubated but awake can be asked to write down answers and can be scored based on their response. This R3 is evaluated by having the patient say the following words: Mama, Tip Top, 50-50, Thanks, Huckleberry, and Baseball Player. You can either have the patient read these words or you can just have them repeat back to you. A score of 0 is given if there is no slurring of speech. If there is mild slurring but the words can be understood, the patient will score a 1. If the speech is so slurred that speech is unintelligible or the patient is mute, then score a 2. If the patient is intubated or there is some other physical barrier to speech, then a UN for untestable can be given for this item. To test extinction, have the patient close their eyes and identify if you are touching the right, left, or both sides. Test the arms and the legs and the face. Usually the test is performed by touching one side, then the other, and then both sides at the same time. If the patient is unable to identify that you are touching both sides at the same time and only indicates one side, then they will score a 1 on this. Next, test the vision. To assess for visual extinction, hold both hands in front of either the upper or lower quadrants. Ask the patient to identify which side the fingers are wiggling on. Extinction is present if the patient cannot identify that both sides are being wiggled at the same time. If the patient has both visual and tactile extinction, then a score of 2 will be given. If only one or the other exists, then a score of 1 will be given. On the next page, you will see your total score. This will tell you what levels you have given the patient a score on and what the total score is here at the top. So if we gave this patient a 1 for some mild asymmetry, he had some left arm weakness and had some sensory loss on the left side with some language deficits. So a total score of 7 was given. You can then take the score and you can transfer it over to your electronic health record, or you can email the results, and you can see they're a little bit more difficult to read on this screen, but you can still get the idea of it. The total score is here at the bottom, and the facial palsy, the arm weakness, all the same scores are there. Simply click on email, and you can email it to whoever. It will automatically populate people from your email, from your address book, or you can enter a new address. And then just hit send and it will go. The last item I wanted to show you on this app is the NIH Stroke Scale booklet. And this just tells you where the information came from. The information came from the book No Stroke, Know the Signs, Act in Time. So you can see where all the information came from and know that it is from a credible source. I hope that you will be able to use this application in the future to help you with scoring on the NIH Stroke Scale if you are presented with it. Do note, though, that the examiner of an NIH Stroke Scale should take the certification exam. It should not be something that is just done by any individual on the street. Thank you for taking the time to listen to me.